Welcome everyone. I'm excited to welcome you to today's session. We'll be focusing on the Prometric MCQ of the day for Qatar nurses. Today's presentation is titled, Qatar Prometric MCQ 2025, Must Know 10 Questions with Explanations. Over the next few minutes, we'll go through some key questions you need to know, along with clear explanations to help you prepare effectively. Let's dive in and get started. When it comes to medication and treatment, it's crucial to understand what should not be given, especially in cases of deep vein thrombosis, or DVT. Now, DVT is a serious condition where blood clots form in the deep veins, typically in the legs. If not managed properly, it can lead to complications like pulmonary embolism. So, what should we avoid giving to patients with DVT? First, we must steer clear of certain medications that could worsen the clot or increase bleeding risk. For example, some drugs like certain hormonal therapies or medications that thin the blood too much without proper supervision can be dangerous. It's also important to avoid applying heat or massaging the affected area, as these actions can dislodge the clot and lead to a potentially life-threatening embolism. Overall, the key message here is to be very cautious about what treatments are administered to DVT patients and to always prioritize safe, evidence-based practices. This ensures we do no harm and manage the condition effectively. When managing a patient with deep vein thrombosis, or DVT, it's crucial to understand what treatments are appropriate and which are not. On this slide, we're looking at options that might seem helpful but could actually be harmful in certain situations. So, what should a patient with DVT not be given? First, let's consider compression stockings. While they are often used to improve blood flow and reduce swelling in many venous conditions, in the case of active DVT, they could potentially dislodge a clot and cause a pulmonary embolism. That's why we usually avoid compression stockings until the clot is stabilized or resolved. Next, ambulation or walking is generally encouraged in DVT patients to promote circulation and prevent complications like post-thrombotic syndrome. So, ambulation is typically safe and beneficial, not something to avoid. Leg elevation is another supportive measure. Elevating the leg helps reduce swelling and pain, and it's safe in DVT management. Finally, anticoagulants are the mainstay of treatment for DVT. They prevent clot growth and new clot formation. So they are definitely given, not avoided. To sum up, the key point here is that, while many supportive measures are helpful, compression stockings should not be used in the initial management of active DVT because of the risk of dislodging the clot. This highlights the importance of understanding which interventions are safe and appropriate at different stages of treatment. Let's talk about ambulation, represented here by the letter B. While it might seem like moving around is always beneficial, in this context, ambulation actually increases the risk of embolism. This is particularly important to understand because early or excessive movement can sometimes dislodge clots or other blockages that may have formed. So, even though mobility is generally good for circulation, we need to be cautious and monitor patients closely. Remember, the key point here is that ambulation, while helpful in many situations, can pose a risk for embolism under certain conditions. This ties into our overall theme of managing patient activity carefully to prevent complications. In deep vein thrombosis, or DVT, a blood clot forms in a deep vein, typically in the leg. It's really important to understand that initially, ambulation or movement should be avoided. Moving around too early can dislodge the clot, which increases the risk of a pulmonary embolism, a potentially life-threatening complication. To help manage this, compression stockings are often used because they assist in improving venous return. This means they help blood flow back toward the heart more effectively, reducing the risk of the clot getting bigger or causing other issues. Leg elevation is another key intervention. Elevating the leg helps reduce swelling and decreases venous pressure, making the patient more comfortable and preventing complications. And of course, anticoagulants play a crucial role. They prevent the clot from extending and stop new clots from forming. These medications are vital in managing DVT and reducing the risk of serious complications. All these measures work together to control the condition, prevent worsening, and promote recovery.